Hello and welcome to this live interaction with me, Ashish Parekh. And COVID-19 is something that everyone has been talking about right now, and also the fact that there have been various ways which are being figured out to counter this particular virus till a vaccine has comes into the market. And one of the ways that a lot of people are possibly talking about is developing herd immunity. But well, new research data and also new voices that are coming out from the community say that herd immunity is not really a great option. In fact, a group of 80 researchers have warned that herd immunity approach to managing COVID-19 by allowing immunity to develop in low-risk population while also protecting the most vulnerable is a very dangerous precedent which is not supported by scientific evidence. And also they've in fact gone on and written this particular thing in an open letter that has been published on Thursday in the Lancet. In fact, this particular open letter has been signed by 80 international researchers with expertise spanning public health, epidemiology, medicine, pediatrics, sociology, virology, infectious disease, health systems, psychology, psychiatry, health policy, and also mathematical modeling. In fact, these authors have acknowledged that ongoing restrictions have understandably led to widespread demoralization and also diminishing trust among the public, and that in the face of a possible second wave of infection in countries like India, there is of course a renewed interest in the so-called natural herd immunity approaches. But they've also gone on to say that any pandemic management strategy that relies upon something like an immunity from natural infections for COVID-19 is flawed in nature. In fact, according to researchers, there is no evidence at all for lasting protective immunity for this particular coronavirus after natural infection. In fact, they've gone ahead and warned that this waning immunity could possibly result, which is a result of natural infection, would not really end the COVID-19 pandemic, but instead resulted in repeated waves of transmission over several years. And this can only be stopped once there is a vaccine. Now, they've also said that this could place vulnerable populations like those who are elderly, those who have comorbidities at risk for indefinite future, as natural infection based herd immunity strategies could possibly result in recurrent epidemics time and again till there is a proper mass vaccination. Instead, the authors have gone ahead and said that the virus needs to be suppressed in the population till there is some sort of a vaccination or there is a mass vaccination in place. And they've also warned that natural infection based herd immunity approaches risk impacting the workforce as a whole, and this could possibly go ahead and overwhelm the ability of healthcare systems to in fact counter. Because yes, you might go ahead and feel that low risk population could get the virus, and then there could be some sort of a herd immunity that could be developed, but can our health systems in fact counter all of this? This is a big question mark, and this is a risk that a lot of countries do not really want to take at this point in time. To speak to us more about this, I've got our expert for the day, Dr. Hirenappa, who's a consultant pulmonologist from Columbia Asia Hospital. First of all, Dr. Hirenappa, thanks a lot for joining us on this live interaction. My first question to you is, there is a lot of growing voice in medical community about raising direct questions at the future of herd immunity, because yes, everyone's talking about herd immunity, but is this really the right thing? Is this really the right way to look at countering COVID-19?
Herd immunity is not only the solution, because we don't have many other options now. Vaccines is still not available, and specific therapy, almost we are certain that remdesivir is working and we have good recovery rate with remdesivir. There are two things which can happen. One, you get an absolute correct treatment like H1N1, we have oseltamivir, it will recover. Like that, if you get an absolute treatment, it will end. Or if you get a proper herd immunity, it will end. But herd immunity, they say that it will affect only the elderly, comorbid and other things. But it is very unlikely. Even 40-year-old people without any comorbids, they can die if they present late to us. So by allowing general populations to just get exposed yourself and get recovered and develop antibodies on their own and say that they are immune to that, it is a false way of thinking. So we have to protect vulnerable population. That's right.
Yeah.
But now we are almost reaching to the herd immunity only. We are seeing lot of patients in a surveillance they have to do with antibodies, and we have in the community people who have a fever 1 day, 2 days without even testing, they would have recovered on their own, because COVID manifests with varied amount of manifestation. Few people will have 1 day fever and they recover, they don't have any complications. Few people, they require some antibiotics or doxy, ivermectin, they will recover. Few people require a higher end treatment, hospitalization and all. Since it is varied manifestation, it doesn't follow, even if the same disease in different people and different age population based on the immune status and comorbidities, we can't totally believe on only herd immunity. But as of now, there is no other alternative thing. But specific therapy has come in terms of remdesivir, and if they come early, they will definitely improve. But if vaccine comes, the game will change. I feel so.
Absolutely. Also, doctor, you're talking about this possibly being one of the better options that we have at this point in time. But the question that arises is, we still do not know how long the immunity lasts. For example, even if we get a herd immunity, we do not know how long it will last. For example,
So
if it lasts for 100 days, 100 days later we'll be back to square one. Everyone will get reinfected again. So that's again a dangerous thing to try.
True. Because once you are getting infected, after 28 days, you will get antibodies for the COVID. And these antibodies will last for up to, because whenever they give a plasma therapy also, from 28 days to 3 months is the time they can give their plasma. Their antibodies will be peak, antibodies will be there. Since COVID mutates, because the form of mutated corona, what is there in India is different from what is there in Italy. That's what many saying is. Since it is mutating, reinfections chances are being there in talks about among the researchers. Exactly. So once you say it is like only one infection and you get herd immunity and later you are okay, it doesn't serve purpose, because you may get a same coronavirus which is mutated and infect again in the same person who is recovered also.
Exactly.
So that's why we are not going into that herd immunity option very well. But most of the time, if the common strains which are available, once they are infected, they will be protected and they should not have a severe illness in future if they get reinfected. Like influenza, every year the strains change. So we get a vaccination with a strains which are changed every year because of influenza surveillance they will do, and with the 4 strains which are most killer form of influenza, those vaccines every year in June to September we will get vaccinated. Similarly, the corona will be studied in future. Probably we will get a vaccination for corona, and that has to be modified every year. Exactly. And so that's the way it is heading towards. As I am seeing on ground, it's almost 5 months on with patients, and some patients are coming up, they may not respond, and our standard precautions, the way we are living, that it will change in future.
Absolutely. Also, doctor, now again this brings us back to the same old question, that is, can herd immunity be trusted as far as COVID-19 is concerned? Because one thing that we're noticing is that, we get to that. The one thing that we're noticing at this point in time is the virus is still a mystery to a lot of people. We still are finding out new things about a virus. So, herd immunity is something, because a lot of governments have come on record and said that herd immunity could be a very good option. But now all of these voices that are coming out, and also yourself, you're also pointing out how it is not a very good option. All these governments need to take note of this particular voice that is coming out of the medical community, that no, vaccine is something that we need to focus on, and herd immunity, something like herd immunity could be a short-term solution, but it could again lead to recurring epidemics wherein you'll have again several peaks and several crusts of this particular virus, right?
Yeah, true. What happens, each country has their own strategies. Few Scandinavian countries and all, they have made, if they don't have drugs there, they have made mask as mandatory. And few European countries, like they are only protecting vulnerable population, because they can have complications because of COVID, and their risk of death is very high.
Exactly.
They are saying that you can have millions of people who are infected, but we should have a number of deaths as less as possible. For that, the risk factors is more than elderly. So this vulnerable are reverse isolation they are doing, because they are giving isolation, or they have to be under isolation for 3 months. They are not allowed to go outside and all. UK adopted that strategy.
Exactly.
Few countries have adopted different strategies. Few countries like Pakistan, the neighboring country, they have not used any lockdown also. They just allowed. Lockdown has different implications. So we are learning from the experiences of all the countries how exactly the strategy is there, and we should modify it in such a way that it doesn't affect our economy also and daily survival and this thing, and still try to containing with the standard precautions like mask, sanitizing and social distancing, and provide the testing facilities and treatment facility, quarantine facilities and drugs and other things, and it will go on and go on and go on and on. But in the meantime, whether you like it or not, many people are in the community as this thing. We are heading towards the herd immunity only, because the more and more populations are getting affected, and herd immunity, we are reaching closer and closer to the getting herd immunity for the virus which is present there, not the mutated form.
Exactly. Yeah.
You are
all
right.
No?
So if 60% of the population gets affected, then it is, every second person we are seeing is COVID. No, some people, they don't have symptoms, they test for some other procedure, they are coming as COVID. So COVID is really infectious. The one good thing is it doesn't affect pediatric age group. Elderly vulnerable should be separated, and it is a combination. It's not only the herd immunity. If you have some amount of herd immunity, we have vaccination at hand. We have a specific therapy which is available on the ground that overall decreases the mortality of COVID. Nobody should die of COVID infection. That is the goal which I am also looking in practice. And it's okay. Some drugs are no evidence and other things. They should not die.
Absolutely.
They can have minimum admission and they can go. But death is something which is severe.
Absolutely. Thanks a lot, Doctor, for joining us on this live interaction. That was Dr. Hiranappa, who was a consultant pulmonologist at Columbia Asia Hospital, clearly pointing out towards the fact that there are various strategies that a lot of countries are, opting for, and also, herd immunity is something that a lot of countries have discussed about, but that might still not be the best solution given the fact that there are several issues with that. One, even if you develop a herd immunity, that might be for the current coronavirus and not for the mutated one. And once that comes in, again, you'll have a series of peaks in several other countries and a series of infection that keeps recurring until we have a vaccine. So the only solution as of now that everyone needs to focus about is for the vaccine. And till then, the vulnerable groups need to be protected and made sure that they do not really succumb to this particular virus. Also, do let us know what you guys think about this video, and also don't forget to like, share and subscribe to News 9 Digital. Thanks a lot for watching.